Hello, everybody. This is Gary. Today is Wednesday, February 8th, 2023. It is 10:58 a.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today's not doing so bad. I'm not doing so bad. I have an appointment at 2 o'clock with my urologist. I'm seeing my peer support specialist day after tomorrow. My peer support specialist is a person who has a mental health diagnosis, who works as a counselor assigned to the clinic that I go to. But I also have a psychotherapist, and I will be seeing her next week. I just saw my psychiatrist last week. We made no medication changes. He is aware that I was diagnosed with pulmonary fibrosis, which is when scar tissue starts to appear in the lungs and sometimes it spreads. Even though it's not cancer, it's usually caused by some sort of chemical irritant. And the only thing I could think of that might cause it is that I was cleaning my apartment over the past 2 years with too much bleach, and the fumes from the bleach scarred my lungs, which makes it more difficult for my lungs to exchange carbon dioxide and oxygen in and out, and it makes it more difficult to breathe, and I get out of breath very easily, even if I'm just going for my daily walk and physical therapy exercises. I do have an appointment with the pulmonary specialist, I believe, on March 28th. They will run some tests, and I will talk to the doctor and know more then. Right now, I'm not sure how bad it is, how severe it is, how much it spread. I accidentally caught it when I was going through my online medical records. I had an abdominal scan in the emergency room to check for internal bleeding. They didn't find any internal bleeding, but they did find on my CAT scan image that I do have pulmonary fibrosis. I don't know how severe it is. I don't know how much it's spread. I still do my daily walk and exercises, and I still do all my other physical activities like go food shopping, laundry, whatever it needs to be done. I'm still doing those things. The pulmonary fibrosis definitely heightens my anxiety levels, because when I first looked up pulmonary fibrosis online before I even talked to my primary care, it said that the life expectancy after diagnosis with pulmonary fibrosis is 3 to 5 years, and I'm 57 years old. I would rather not die in the next 3 to 5 years, but I don't know that for sure. What I was looking up was worst case scenario, and I just don't know how bad or severe my pulmonary fibrosis is. I may have much longer than 3 to 5 years. There's no way of knowing that yet. But I'm taking it one day at a time. It does affect my psychiatric symptoms. It heightens my anxiety, which can heighten my auditory hallucinations, which are not that bad right now. It can heighten my paranoia and delusions, which are not that bad right now. And it can heighten my depression, which is not that severe right now. Not much to talk to my urologist about today. I'm not having any urinary retention or any problems like that I've had recently. It's just an appointment to check in with him and see what's going on, if anything. But I don't think there's anything going on. But I am going to keep the appointment just to stay up to date with all my medical appointments and medical advice, as well as my psychiatric, psychotherapy, and counseling appointments. I rarely miss my appointments. If you have schizoaffective disorder or schizophrenia, it's extremely important to keep all of your medical appointments, all of your psychiatric appointments, all of your psychotherapy appointments, and all your counseling appointments. So that's what I do as much as possible. I rarely miss my appointments. But nothing else to report on. Like, comment, share, subscribe.